Starting today, we're going to discuss a new book, published on May 14, 2024, titled, Good Energy: The Surprising Connection Between Metabolism and Limitless Health. If you're currently paying attention to your own health or your family's, and want advice from a book, this is the one. The author, Calley Means, is an American functional medicine physician and also an entrepreneur. She founded a digital health company called Levels Health, which focuses on preventing and treating chronic diseases by optimizing metabolic function. Born in 1987, Means is a 37-year-old woman. The book has a second author, Calley's brother, Calley Means. But the entire book is written from Calley's first-person perspective. We've previously shared insights from Peter Attia's Outlive: The Science and Art of Longevity. Attia argued that the root cause of most modern deaths boils down to 4 chronic diseases: heart disease, cancer, neurodegenerative diseases, and type 2 diabetes. All of which are closely tied to metabolic health, or simply put, poor diet and lifestyle. Means' new book expresses a similar view, but it's worth exploring, because her perspective is more radical and thorough. This book is essentially a declaration of war against the U.S. healthcare system. Calley Means graduated from Stanford Medical School and completed 5 years of residency training. She was on track to become an ENT surgeon. But just before finishing her training, at the age of 30, she abruptly quit the hospital, gave up becoming a specialist, and pivoted to functional medicine, aiming to manage personal health in a holistic way. Her approach is similar to Attia's, currently a hot area in startups. And to put it in Chinese terms, it's about helping you tune your body. But Means takes it even further. You might know that this year, an independent candidate from the Kennedy family, Robert F. Kennedy Jr., is running in the U.S. presidential election. Means and Kennedy co-founded a movement called Make America Healthy Again, MAHA, modeled after Trump's Make America Great Again. This movement has gained Trump's support, and Kennedy has since endorsed Trump. Currently, Kennedy is serving as the U.S. Secretary of Health and Human Services, and Calley Means has been nominated by President Donald Trump to be the Surgeon General. So, here's the story. A rebellious young doctor becomes an entrepreneur, writes a book, launches a movement, joins Trump's cabinet, and might lead a healthcare revolution in the next 4 years. At the very least, this narrative fits Trump's style well. Given how young and radical Means is, I was initially concerned that her book might lack academic rigor. But after doing some research, I found the reviews to be surprisingly positive. While some are cautious about a few of her claims, most support her overall viewpoint. That's quite intriguing. As you read through the evidence cited in the book, the facts are undeniable. You'll be shocked that the healthcare system hasn't reformed already. But the good news is, you can still choose to live a healthy life. Today, let's start with the major problems that Means exposes. There was once a 36-year-old woman named Lucy. She believed she was in decent health, but in the past year or two, she'd been plagued by minor issues. She had mild acne. She sometimes felt bloated after eating. After moving to a new city, she began experiencing anxiety and even signs of depression, possibly due to loneliness. She developed insomnia. Lucy saw a dermatologist for her acne, a gastroenterologist for her stomach problems, a psychiatrist for her anxiety and depression, and a primary care doctor for her insomnia. The bigger problem? Lucy and her husband had been trying to conceive for 2 years with no success. Tests revealed she had polycystic ovary syndrome, PCOS. They were considering in vitro fertilization, a significant financial and emotional undertaking. If this were a Chinese patient, someone might have suggested traditional Chinese medicine to rebalance the body. Lucy thought similarly. But she went to Calley Means. Means also believed Lucy had a systemic issue. But instead of talking about cold or deficient organs, she focused on improving Lucy's metabolic system. Her intervention was successful. Within 6 months, Lucy's minor issues disappeared, her ovarian function appeared to normalize, and she was actively preparing for pregnancy. The underlying principle: metabolic dysfunction is often the starting point of other health problems. It disrupts the cardiovascular and immune systems, triggering issues like Lucy's. If left unchecked, these lead to chronic illnesses, and eventually to more serious diseases. Both Means and Attia believe that modern medicine is excellent at treating acute illnesses, cuts, infections, emergencies, where hospital intervention is often swift and effective. But when it comes to chronic diseases like type 2 diabetes, Alzheimer's, or atherosclerosis, modern medicine is of limited use. That's why life expectancy in the modern era has plateaued after reaching the 70s or 80s. There are two important insights about chronic disease. 1. They are primarily caused by unhealthy modern diets and lifestyles. 2. They are becoming more and more common. Infertility is a classic example. Sperm counts in men today are 50 to 60% lower than they were 40 years ago. Isn't that a major crisis? Means believes these problems are systemic and can't be solved by simply treating symptoms in isolation. In her 5th year as a resident, Means treated a 52-year-old woman with recurrent sinus infections. The patient constantly had a foul smell in her nose, had difficulty breathing, and had tried many antibiotics and nasal sprays without relief. Surgery was the last resort. Means performed the surgery, opening the bones near the nose and removing swollen tissue from the sinus passages. A delicate operation, as the site was just millimeters from the brain. The surgery was a success, and the patient expressed heartfelt thanks. But Means felt no pride. Instead, she felt like a failure. She knew this patient would soon develop more health issues. She would spend the rest of her life bouncing between hospital departments. The sinus infections weren't just about her nose. They were symptoms of chronic inflammation throughout her body. Today it's sinusitis, next time it might be an ear infection, and then arthritis. You treat one area, another problem pops up. Drugs and surgeries only address the surface. The real issue wasn't the sinus infection. It was systemic chronic inflammation. But no specialist was trying to solve that. That's why Means resigned. Inflammation is supposed to be quick and temporary. When you get injured or infected, immune cells rush to the site to defend you. Like firefighters spraying water, these cells release chemicals, called inflammatory cytokines, to clean up. This causes visible inflammation. Fever, redness, swelling, pus. Which is normal. Once the job is done, the immune cells back off, and the inflammation subsides. Chronic inflammation, however, is a sign of deeper cellular dysfunction. The mechanisms are complex, but in simple terms, an unhealthy lifestyle and poor diet prevent what Means calls good energy from reaching cells efficiently, leaving them energy-deprived or metabolically imbalanced. For example, in Outlive, Attia described how excess fat can block insulin from delivering glucose into muscle cells. These cells end up energy deficient despite the body being overnourished. A paradox. There are other mechanisms too, which Means calls bad energy. When cells lack energy, they send distress signals. Immune cells respond and flood the area with inflammatory cytokines. But if the root cause, say, insulin resistance, isn't fixable on the spot, immune cells remain permanently activated. That's chronic inflammation. At the cellular level, the entire body is in turmoil. In Means' words, the cells are afraid. Beyond inflammation, metabolic issues also lead to oxidative stress and insulin resistance. As insulin becomes less effective at delivering energy, the body compensates by producing even more of it, leading to chronically high insulin levels. These underlying problems are the root causes of most chronic diseases. For example, depression is sometimes linked to inflammation. The brain accounts for just 2% of body weight, but consumes 20% of total energy. It is extremely sensitive to energy deficiency. Inflammation and oxidative stress deprive brain cells of energy, potentially leading to depression, Alzheimer's, and ADHD in children. Alzheimer's, due to its link with insulin resistance, is even referred to by some as type 3 diabetes. You might not expect this, but irritable bowel syndrome, IBS, is also linked to depression. That's because of the gut-brain axis, through which gut microbes influence neurotransmitters that regulate thought and emotion. Chronic diarrhea can lead to depression. Some doctors even prescribe antidepressants to treat IBS. Arthritis is largely caused by chronic inflammation, which damages joint tissue. Weight also plays a role. Every pound of extra body weight adds 4 pounds of pressure on the knees. Other chronic pain conditions, including migraines and hearing loss, are also tied to inflammation, insulin resistance, and oxidative stress. Adult acne on the face or neck is often a sign of inflammation and blood sugar imbalance. While science hasn't fully uncovered the mechanisms linking metabolic dysfunction to autoimmune diseases like rheumatoid arthritis, lupus, psoriasis, inflammatory bowel disease, and multiple sclerosis, the correlations are strong and well documented. Hormonal imbalances are the main cause of infertility in both men and women. In men, obesity raises the levels of an enzyme in fat tissue that converts testosterone into estrogen, reducing sperm count. In women, insulin resistance stimulates the ovarian theca cells to produce more testosterone, leading to PCOS. Not to mention the well-known metabolic connections to type 2 diabetes and atherosclerosis, the latter raising the risk of stroke and heart disease. There's a term in medicine called comorbidity, meaning certain diseases often occur together. Hypertension patients often also have type 2 diabetes. Obese patients often suffer from depression. Women with infertility often have type 2 diabetes. Every doctor knows this, and they'll advise patients to get tested accordingly. But they each treat their own area. No one steps back and says, "You actually have cellular dysfunction." The key point is this. These illnesses don't occur randomly, nor are they purely the result of genetics. All of those symptoms are consequences of cellular dysfunction. Of course, no single theory can explain everything, but Means argues that, for most Americans, metabolic dysfunction is the primary driver of cellular dysfunction. An unhealthy diet and lifestyle lead to metabolic dysfunction. Metabolic dysfunction leads to cellular dysfunction. The early signs of cellular dysfunction manifest as seemingly minor issues: fatigue, insomnia, acne, gout, arthritis, depression, infertility, and so on. Then come chronic diseases like type 2 diabetes, followed by strokes and heart disease. In other words, when someone constantly feels tired or frequently experiences inflammation in different parts of the body, they're already on the path toward more serious problems. Today's mild symptoms are warning signs. Treating each symptom in isolation might offer temporary relief, but to truly get better, we have to address the root cause. The good news is that, improving metabolic health isn't that hard. In fact, it's one of the most cost-effective forms of medicine. The bad news is that, our current healthcare system isn't designed to help you optimize your body. And that's exactly why Means and others are pushing for a revolution. That's it for today's content. Thank you for watching, and I'll see you in the next video.
If you feel there is value in this, please like, subscribe to this channel, and leave your thoughts or suggestions in the comments section. Let's grow together and read more good books.